Welcome to the BioNexus Health Podcast with Dr. Jody A, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jody A.
Hello, welcome back to Autism Uprooted with BioNexus Health. Today I have some wonderful news for families and practitioners dealing with autism spectrum disorders. They much awaited new formulations and new customized protocols are soon to be here. You know, we've had supply chain issues because of the pandemic over the last couple of years. And as you all know, I'm very particular about obtaining the perfect seeds for the specific herbal blend that I would like to create. And then, of course, it takes time to nurture and grow the herbs in a biodynamic, conscious fashion. Well, the wait is now almost over. I am in the process of testing and releasing soon herbal blend for ADHD, focus, learning, anxiety issues in children on the spectrum. So the AFS blend, the attention, focus, support blend. And the other blend is going to be for speech. It's once again a beautiful blend of organic, biodynamic, handmade, artisanal herbal blends that you have come to expect from BioNexus products. So it is the SPK blend, which is focused for speech, receptive language, motor output, the thinking, processing, word memory, word recall, pragmatic language that is associated with speech, receptive, and motor output. All of these associated functions will be addressed by the SPK blend, will be supported by the SPK blend. So very exciting for me as well, to be able to make these products available, finally available for my patients. Yes, these were individual herbs that I used for my son. And, it takes some time to think about the ratios, the proportions, etc., which herbals blend with which one to create an actual blend to keep things simple versus doing 10, 12 herbs. So these will be coming really soon. Additionally, what I have decided to go ahead and introduce is customized sensory integration protocols for my patients doing sensory therapies. This will be coming soon as well. Once the AFS blend and the Speak blend, the SPK blend become available, I will also be unveiling the essential oil blends and protocols that I have used for my son. That was actually one autism mom who asked me about that. That was very interesting. Like, Dr. Deshore, we heard at an autism conference that you had created an essential oil blend for a scalp massage for Brian to promote circulation because, with SIRS, biotoxin illness, there is vascular endothelial growth factor issues. The visual contrast sensitivity test was fails. So we know that we have reduced blood flow issues, right? So yes, I'm not sure where this mom heard me say that, probably at an after conference meeting. Usually after I do a conference lecture, I am approached by a lot of parents that have questions for me, and that I'm happy to have a mini Q&A session right there outside the conference room. So that's probably where that happened. Someone asked a brilliant question, and yes, I said yes. So yep. So the essential oil blend for scalp massage to promote circulation, will also be available. Now, sensory integration goes hand in hand, right? So it is important to offer customized protocols for oral motor, visual motor, because the visual cortex in the brain and the motor cortex in the brain are very closely connected for proper development of language, visual cues, reading faces, analyzing expressions, body awareness, body language. These are all very important functions that need to develop in close conjunction with each other. And there is a very specific sensory integration protocol for each child, depending on several individual variables. Okay, so that is great. In addition, we also need to understand that with sensory integration therapy, because there are a lot of parents worldwide that are using oral motor therapy. I mean, I'm fully certified for many, many years now in Beckman's oral motor therapy. I'm also, of course, for many, many years now, fully certified sensory integration neurology specialist practitioner. Also interested in having specific and customized protocols so you're not wasting your time and resources. That's what I've been interested in. That's what I've been researching over the years. Those are the programs, the specific programs that I created for my son as well. So higher functions like sensory integration, like for example, like I just mentioned, visual motor, oral motor, there is speech, right? Then there is also body awareness, proprioception. So these higher functions are very closely knit, interestingly enough, with acupuncture and Ayurvedic meridians in the body that are important guides in energy medicine, quantum biology of healing. Of equal importance are the energy centers of the body, or most people know them as the different chakras. For example, the throat chakra signifies communication and motor output of language. So there are specific medicinal herbs that help support and tone this specific energy center. So I think by now you understand where I'm going with all of this. So yes, there is going to be meridian, energy meridian, acupuncture, Ayurvedic meridian, specific herbal blends to support the therapies for children, those who do go to therapies, to maximize their potential, as well as the time and resources that are being spent. Additionally, certification course for parents and practitioners for biotoxin illness sensory integration strategies to be able to create custom protocols for their own child or patients, as the case may be. So this certification course is currently in process. I'm creating it, and I shall release additional information once all this is finalized. So keep an eye on your inbox for our emails, that talk about these new blends, as well as the certification course. And I know it will be a absolutely wonderful, exciting, inspirational addition to the BioNexus protocol for autism. And before you go, you're aware that the BioNexus Approach to Autism book, as well as mom-to-mom support group, is also in the works. So a lot of exciting, BioNexus Academy is being created as well. So I will have more information for everyone as and when these things unveil, as and when these things become finalized. So, all right. Very exciting and happy times ahead. You will be very inspired, as I said before, and also encouraged to keep going because, when you see results from a customized therapy protocol, there's nothing like it. You're seeing results from your herbal protocol, which is addressing the underlying issues. Then you're seeing results from your sensory integration therapy protocol that is customized to your child. You will be able to create, or at least, participate with your practitioner in the creation of that protocol for your child. It's just fantastic. So once again, thank you for joining me. And I will see you at the next podcast. This was just a brief podcast for today, for announcing. And if you have any questions, please use the patient portal and send the questions if you have any questions regarding these. The most common question is going to be, when is my child going to go on this protocol? Well, that will be discussed at your individual appointments, of course. I'm more than happy to do that, right? Everything at the right time, just like we did for the camel milk protocol. Now, there is going to be obviously beginner and advanced stages. Now, using the Speak blend is the advanced stage. The Speak blend and the meridian herbals, along with the sensory integration customized protocol, that is also part of the advanced level of camel milk protocol. So after you've been on the camel milk protocol for a specific while, and we have been discussing at everyone's individual appointments, right? What the child's response is, what the next step should be for the child. So the camel milk protocol began similar for everyone, but by now it has been completely customized for the many, many patients who joined us with that protocol. So yes, the Speak blend and everything that I have spoken about today will be seamlessly integrated into your camel milk protocols, right? As and when applicable. All right, great. So be well, keep smiling, stay strong, and I will see you at the next episode of Autism Uprooted. Namaste.
Thank you for joining Master Herbalist Dr. Jody A. Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.